Hi, I'm Dr Aimee, one of the clinicians at SkinViva. I just wanted to do a little bit of a video blog really, just to explain to you a little bit about the techniques that we're currently using and a bit about our non-surgical nose jobs. There's a number of reasons why you might be considering this treatment. It might be that you've noticed a few areas of your nose that you want to change. So for example, you might notice that the tip of your nose goes down and you'd like to just raise it up a tiny bit. You might notice a little bit of asymmetry on your nose, so you might notice that one side maybe has a little bit of a deviation in it, or a curvature on it, or just a little shadow or a depression in your nose that you'd quite like to fill and make your nose a bit more smooth or a bit more level. You might have had a little bit of volume loss as you've got a bit older, and you'd like to just refill some of that volume back in just to create that shape that you used to have and get that back again. Or you may have already had surgery and be unhappy with the result of your surgery, or have noticed that you've had some cartilage collapsing after your surgery and you want to just create some more volume where that cartilage is collapsed. So they're all possible reasons why you might be considering this treatment. A cannula is a blunt instrument and it's really flexible, so the ability for it to be flexible helps us just put it in one area and sort of fan around that area and deposit the filler wherever it needs to go. And also the fact that it's blunt makes it less likely to pierce any blood vessels. Obviously if you pierce a blood vessel, that's how you get a bruise. So the fact that the cannula is blunt means it can either go around the blood vessel under it and it's less likely to go in it, so that reduces the effect or the risks of bleeding and swelling. So you may have noticed before, we've had treatment here and we've used a needle. So needles are great, they're very accurate and they allow us to deposit filler in lots of different areas. But obviously with using a needle there's lots of little entry points, so with that comes a little bit of bruising, a little bit of bleeding in lots of different tiny areas around your face. Main benefits really with a cannula is that it's a bit like keyhole surgery. We just make one entry point or two entry points and we can fill the filler on various areas just through those one or two entry points. It also makes recovery a lot quicker when you use a cannula because you have less bleeding, less bruising, less swelling. Also because there's less entry points like with a needle, you're less likely to get infections afterwards as well. This cannula technique that we're using for the non-surgical nose job has got so many advantages over using a needle. It helps reduce any bleeding, it helps reduce bruising, it helps reduce swelling and redness, and also helps reduce the risk of any infection. So there are so many advantages to using this over the needle. It might feel a bit unusual when you're having it done with a cannula because the cannula instrument moves underneath the skin and it pushes things out the way to avoid trauma really, but that can, well, clients say it feels a little bit unusual underneath the surface of the skin, but the discomfort is a lot reduced compared to a needle, so it's a lot less painful, there's a lot less trauma and a lot less discomfort. It's also a lot safer. You're less likely to put the cannula into a blood vessel. Obviously we don't want to deposit filler into a blood vessel because if you deposit filler into a blood vessel you could cause a blockage and that could obviously lead to necrosis or an embolism, which obviously we don't want to happen. So the fact that we're employing this technique makes our non-surgical nose jobs much safer, and the recovery time is much quicker for you than it would be using a needle. So that's really what I wanted to get across to you today in this little video blog, just make you aware that we are using this new technique and it should be a lot safer for you and make healing a lot quicker.